Okay, folks, Medicare costs for 2025 have finally been released. So let's talk about some of those rising premiums and deductibles for 2025. And of course, we're going to talk about some of those other changing benefits as well, so make sure to stay tuned. But first, a brief reminder as to what Original Medicare covers. Now, if you're not new here and you're just here for those costs and changes, then scroll on down to the video chapters below and feel free to skip ahead. So anyway, Original Medicare is comprised of Part A, which is your hospital insurance, and Part B, which is your medical insurance, basically anytime you see a doctor. Together, they're going to cover most of your medical needs. So Medicare Part A will help to cover things like inpatient care in a hospital. That's, of course, if you're admitted into the hospital for any type of procedure or observation. Skilled nursing facility care, which is if you need to receive skilled nursing treatment, usually after having been hospitalized. Behavioral and mental health, hospice care, home health care, and nursing home care. These two are really where people get confused. So skilled nursing facility is not for long term. It's really for habilitative and rehabilitative services after you have been hospitalized. Nursing home care is also not long-term or custodial care for somebody, for example, who has Alzheimer's. It is just rehabilitative or habilitative services that you receive by a skilled nurse in your home. And Medicare Part B will help to cover things like ambulance services, although they can be expensive. And of course, there is a coinsurance, more on that in just a little bit. Clinical research studies, durable medical equipment. These would be things like wheelchairs, walkers, pumps for insulin, limited outpatient prescription drugs. This is so important because Original Medicare really does not cover prescription drugs. So things that you might take on a daily basis, perhaps to manage your cholesterol or your blood pressure, would not be covered by Original Medicare. However, there are, of course, exceptions. Vaccinations and injections administered in your doctor's office, chemotherapy, certain oral anti-cancer drugs, insulin if it's administered via pump, etc. Then mental health and substance use disorders are covered, and oxygen equipment and accessories. Now, there may or may not be copays or coinsurance for these specific services and benefits, and of course, you'll have a monthly premium to keep your insurance active. And before your insurance begins to contribute to the cost share, you may have to meet your deductible. So let's talk about those 2025 costs and how they compare to 2024. But before we do, a friendly reminder to please make sure to like this video to get this information out there. And of course, please make sure to subscribe. We do release these videos on a weekly basis. Now, we are licensed health insurance brokers and we're licensed nationwide. So if you have any questions whatsoever about your Medicare or health insurance in general, you can reach us in the comments below, but also at the number on the screen. And of course, there is no charge for our services. All right, let's get back to it. So let's start with those Part A costs for 2025. So this is the breakdown of Part A costs, which can be found on Medicare.gov. So your premium for Part A. Now, for most people, there is no premium. This is because your Part A premium is determined by yours or your spouse's work history. So if you or your spouse have worked long enough to qualify, that's 40 quarters, which is about 10 years, then you will not have a premium for Part A. If you don't qualify for Part A, then I have to be honest, the premium is really expensive. So in 2025, it's $285 if you or your spouse have worked between 30 to 39 quarters. Remember, once you get up to that 40 quarters, the premium drops off. If you've worked less than 30 quarters, then it's actually $518. This is, of course, an increase from 2024. In 2024, it was either $278 or $505. Then there is the deductible. Now, this is applied per benefit period, which is very confusing. Basically, you can think of benefit periods more akin to a hospital stay versus on an annual basis. So if you have to be hospitalized in February for a knee surgery, then you would have to first meet your deductible before your insurance begins to contribute to the cost share. So in 2025, that deductible is $1,676 as opposed to $1,632 in 2024. Let's say later in the year, let's say September, so we're still in the same calendar year, you have to again be hospitalized either for the same thing or a different thing. You would once again have to meet that deductible. And this is one of the reasons that Medicare supplement plans, also known as Medigap plans, are so very helpful because those deductibles are pretty high. And then there's the actual coinsurance or copays once you've been admitted to the hospital and you've met your deductible. So for days 1 through 60, it was $0 in 2024, $0 in 2025. Now, per day, if you need to be hospitalized more than 60 days,
In 2025, it's $419 per day, $408 in 2024. For days 91 through 150, it will be $838 per day, up from $816 in 2024. And of course, after 150 days, you pay all costs. That has not changed. Now, if you need to recover after being in inpatient care in a hospital and at a skilled nursing facility, then for days 1 through 20, it's $0. Days 21 through 100, $204 in 2024, $209.50 in 2025, and more than 101 days, you pay all costs. Again, these copays are why Medicare supplement plans are so important, because usually they will cover all of these copays. Home health care, these amounts have not changed. 0 for home health care services, 20% for durable medical equipment, and hospice care, $0 for covered hospice services.
Now let's talk about Part B. So unlike Part A, there actually is always a monthly premium for Part B.
So in 2025, really the only changes that we're going to be talking about are the premium and the deductible. I'll go through those other changes, or rather those other costs, but they pretty much always stay the same. So in 2024, the base premium for Part B was $174.70. Now, that base premium is determined by your income. So if you are a higher earner, you may have a higher monthly premium. And of course, it's going to be higher in general in 2025 because it's going to be $185. That's the base premium. More on those tax brackets and how you might have to pay more in just a minute. And then there's the deductible. Now, unlike Part A, this is a once annual deductible. Once you've met it for the year, you don't have to meet it again. There's no benefit periods or anything. In 2024, it was $240. In 2025, it's $257. Now, the rest of the Medicare Part B covered services, pretty much it is just 20% of the Medicare approved amount. So that the actual cost may change if the Medicare approved amount has changed, but the coinsurance, that 20%, has not changed.
Now, something very, very important for you to know is that Medicare is looking at your income from 2 years prior. And as we've discussed, that Part B monthly premium is tied to your income. So if you are now making a lower income, perhaps because you have retired, go ahead and file for IRMAA, which is Form SSA-44. That way you can have an adjusted amount to reflect your new and lower income.
So this is the form in question, but I'm actually going to take you to a different website that'll more clearly detail what your premiums will be based on your income. Okay, so over here you can see that if you are an individual who makes $106,000 or less, or married filing jointly $212,000 or less, then your monthly premium will be $185. If you make more than that, then it's going to be adjusted based on your income. So between $106,000 to $133,000 as an individual, or $212,000 to $266,000 if you're filing jointly, then your monthly premium for each individual is $259. $133,000 to $167,000, or $266,000 to $334,000, $370. $167 to $200, or $334 to $400, $480.90 per person. $200 to $500, or $400 to $750, $591.90. And if it's more than $500 or more than $750, it's going to be $628.90 per person per month. Now, what's very important is, of course, that Medicare is looking at your income from 2 years prior. So if you were making a higher income, but now you're making less because you've retired, you do want to go ahead and file this form. That way you have the lower Medicare Part B monthly premium.
If you're unsure where to find that form, let me know in the comments below and I'll send you the link. Now let's talk about some of those other changes coming in 2025, the good and the bad.
This is the Medicare and You Guide for 2025. It is chock full of really helpful information. If you're having trouble finding it, let me know and I'll send you the link below in the comments. So here are some of the new and important things. So catastrophic coverage is now capped at $2,000. There is no more donut hole. That means you move directly from the initial coverage phase into catastrophic coverage. If your prescription drug spending hits $2,000, then you're in catastrophic coverage and your insurance carrier will take on your copays or coinsurance for your covered in-network prescriptions that are included on your formulary for the remainder of the year. Now remember, this only applies to prescriptions that are on your plan's formulary. So unfortunately, if your prescription is not included in your plan's formulary, then this $2,000 means absolutely nothing. Even if you were to go on Medicare.gov, if you were to put in that prescription, you would see that your estimated yearly spending could be more than $2,000 if that prescription is not included in the plan's formulary. So that is very, very important. We also have expanded mental health and well-being services. So before, really, it was either inpatient or outpatient care, and there was really no in-between. Now they have expanded those services for more intensive outpatient services. More resources for caregivers. I suggest that you take a look at this to learn a little bit more. Changes to telehealth. This is a very sad change. As of December 2024, so the end of this year, telehealth will no longer be available. And that really is a pretty bad thing, if you ask me. Let me know in the comments below. Additionally, some things that are sort of underway. We have some of those changes to Part D and also Medicare Advantage plans. So those would be things like the premium stabilization program that is going into place, as well as those negotiated drug prices. Now, those negotiations are happening now, and they should become effective 2026, and more prescription drugs will be added every year.
Now, some of these changes will, of course, affect Medicare Advantage plans, which are a replacement for original Medicare plans, and of course, Part D as well. Now, if you'd like to learn more about that, I highly recommend you check out this video over here. And if you want to learn more about Medicare in general, make sure to check out our Medicare playlist. As a reminder, we are licensed nationwide, so if you have questions, you can reach us in the comments below or at the number on the screen. There's no charge for our services. And before you go, make sure to like and subscribe. We'll see you next time.